10 cat behaviors you should never ignore. One could save their life. Cats are mysterious, dependent, and surprisingly good at hiding pain. But what if your cat's strange new behavior is more than just a cat thing? Today we're diving into 10 cat behaviors you should never ignore, because one of them could literally save your cat's life. So whether you're a new cat parent or a seasoned feline fanpay, close attention. These silent signs speak louder than you think. 1. Hiding more than usual. Cats love cozy corners. But if you're outgoing, kitty suddenly vanishes under the bed for hours or isolates themselves, it's a red flag. This behavior often signals stress, pain, or illness. In the wild, cats hide when they feel weak. Domesticated cats do the same. If your one social furball now avoids eye contact, guests, or even you, don't wait. A vet visit could reveal an issue like a urinary blockage, injury, or infection often treatable when caught early. 2. Sudden litter box issues. Litter box problems are never just annoying, they're communication. Is your cat peeing outside the box? Straining? Going more or less than usual? It might be a UTI, kidney disease, bladder stones, or emotional distress. Cats with cystitis often associate the box with pain and start avoiding it. Pro tip: keep a journal of litter habits. If things suddenly change, your vet will have a useful baseline. 3. Overgrooming or fur loss. Yes, cats groom to stay clean. But if your cat is licking the same spot obsessively, or if bald patches appear, it's more than a bad hair day. This could be an allergic reaction, flea infestation, anxiety, or even hyperthyroidism. Some cats silently suffer, and this repetitive grooming is their only outlet. Watch for red irritated skin or constant licking after stress. Treat both the cause and the anxiety. 4. Loss of appetite. Food refusal is never normal for cats. Even missing one meal can trigger fatty liver disease, which can be fatal if not treated quickly. Has your cat suddenly turned away from their favorite food? Are they chewing oddly or dropping kibble? Look out for mouth ulcers, dental decay, or nausea from internal illness. Bonus tip: warm up wet food slightly. It boosts aroma and may tempt a reluctant eater. But if the disinterest continues for over 24 hours, don't wait. 5. New or excessive vocalizations. Some cats are chatty Siamese owners, you know what I mean? But if your cat suddenly starts meowing more, louder, or in strange tones, it's time to listen closely. They could be in heat, confused, or experiencing pain. Yowling at night is especially concerning in older cats. It could signal hyperthyroidism or cognitive decline. Also, a cat that stops meowing might be suffering in silence. Vocal change is often the first sign something's wrong. 6. Limping or difficulty jumping. Cats are agile by nature. If your pet stops jumping onto counters, climbs instead of leaps, or hesitates before chasing a toy, it's not laziness. It might be arthritis, joint injury, or a soft tissue sprain. Older cats especially suffer from osteoarthritis, but hide it incredibly well. A slow walk, a limp, or a pause before jumping are like whispers. Listen to them. Early treatment can make your cat more comfortable and active again. 7. Sudden weight loss or gain. If your cat suddenly drops weight, even if they're eating normally, it could point to thyroid disease, diabetes, or even cancer. Conversely, sudden weight gain can indicate fluid buildup or hormonal imbalance. Don't go by appearance alone. Regular wins help you spot subtle changes. Use a baby scale or weigh yourself with and without your cat. A 2-pound loss in a 10-pound cat is 20% of their body weight. That's serious. 8. Excessive drooling or bad breath. Contrary to popular belief, cats should not drool like dogs. If your kitty's leaving wet spots or has stinky breath, take notice. Dental disease is the #1 cause. Think infected gums, rotting teeth, or oral tumors. Cats will tolerate unbelievable discomfort without showing signs until it's severe. A simple dental checkup might reveal the issue. Left untreated, bacteria can enter the bloodstream and affect the kidneys or heart. 9. Changes in eyes or pupils. Eyes are windows into your cat's health. Dilated pupils, uneven pupils, cloudy lenses, or visible third eyelids could signal everything from high blood pressure to neurological problems. One sign many miss. bumping into things, or hesitating in low light. That might mean progressive vision loss. Eye changes often reflect systemic diseases, including feline leukemia, hypertension, or trauma. Never dismiss them. 10. Sudden aggression or withdrawal. Does your sweet cat hiss when touched or swat when you get close? That's not attitude, it's discomfort. Behavioral changes like aggression, fear, or constant sleepiness can all reflect physical illness. Painful arthritis, internal infections, or even brain inflammation can cause mood shifts. Especially in older cats, personality changes can be early signs of cognitive decline. Track these shifts and share them with your vet. Your cat doesn't speak in words, but their body and behavior speak volumes. The earlier you act, the better your cat's chances for a full recovery. If you love your cat, pay attention to what they're trying to tell you. Be sure to like, subscribe, and tap the bell so you don't miss our next video. Why does my cat follow me into the bathroom? You might be surprised by the answer.